I'm going to be doing a seat occiput adjustment for a left rotation restriction. So first we're going to assess the left rotation. So I'm going to place one finger on the base of the occiput, another on C1. I'm going to actively rotate the patient's neck. I'm going to feel if the occiput translates forward and it moves into rotation. If not, like it is currently stuck, preventing a left rotation restriction. So the patient's occiput is right rotated on C1. I'm going to take my mastoid fossa. I'm going to place it underneath the patient's mastoid. I'm going to have the patient flex over my contact. I'm going to use my indifferent hand to place it along the ears in the horizontal planar direction. I'm going to rotate the patient's head. I'm going to have her flex slightly, and then I'm going to thrust P to A along the eye, the sight line, eyes. Oh, I'll hold the position once again. Here. Got thrust straight, power in the box zone, and I would thrust P to A along the side of the eye. All right, I have a patient who has a right TMJ issue. Will not go into, has a long axis restriction. So to assess TMJ in the jaw, I'm gonna have the patient open their mouth. I'm gonna place my thumbs inside on your molars. I'm gonna place, I'm gonna grab and pull down a little bit, and just long axis tracks. It's not allowing me to do that. So I'm gonna have the patient lay down on their back. Just a head rest, we don't have any paper back there. So they'll lay on their back. I'm gonna take my hand and support the left side of their head. I'm gonna rotate it. I'm gonna take my pisiform contact, place it on the condyle, and there we go. And as I press, I'm gonna thrust in a direction of the condyle going down the ramus of the jaw. So I would thrust P to A along the ramus and condyle. Patient is presenting with pain in the T6 area. So first we're going to assess. I'm going to take my contact, find T6. First I'm gonna do extension, tight. Okay, I'm gonna do flexion, good. I'm gonna rotate the other way. All right, so I'm finding that we have a right rotation restriction and a right lateral flexion restriction. So I'm gonna have the patient lay face down. So with the right rotation restriction, that means it's left rotated. So I'm gonna go on patient's left side with the right lateral flexion restriction. It means I'm gonna go counterclockwise. So I'm going to take clockwise, thank you. Clockwise, this is the motion. I'm gonna take my bare contact. I'm gonna place her spinous process in between my thumb and my fingers. I'm going to twist in a clockwise fashion. I'm gonna take the deep breath in, patient, and out. And on the breath out, I'm going to continue with the rotation of the clockwise while thrusting P to A. So first we're going to assess the patient's internal rotation of the shoulder. So first we're going to do the left, it's good. Check her right. And restricted. So we have a right internal restriction. What we're going to do is we're going to do a stretch. So I'm going to get you to your place of resistance, and then I want you to push up into me at 20%. Okay? Do this for 7 seconds, relax, okay, push up, 7 seconds, relax, and then one more time, and relax. And that's gonna help induce internal rotation. Patient has an issue with the radial head. I'm gonna palpate, I'm gonna feel, I'm gonna try to move radial head. It's not moving from P to A, so I'm gonna have the patient roll over. I'm gonna take my thumb contact, place it on the back of the radial head, and then I'm going to thrust P to A to move it in the direction of the restriction. Patient presents with a hand issue. First I'm going to assess the carpals. So I'm going to move them, flexion, extension, both the proximal and distal row. Feeling that it's the proximal row that needs, it has a flexion restriction. I'm going to take my finger and block the distal row. I'm going to contact with my two index underneath the proximal row. I'm going to have the patient lean away from me. And then I'm going to do a slight thrust upwards to push it from P to A. Patient presents with a TL issue. Their lower back is hurting them, so I'm going to have you put your hands up on your shoulders like this. I'm just going to palpate TL, extension restriction, definitely. So patient, I'm going to be placing my hand right on your lower back. I'm going to have you take a deep breath in. Yep, cross your arms. On breath out, just tuck your head, and I'm going to compress. Okay? So, got my contact on the TL. I'm going to have the patient take a deep breath in and out. Over the board, and then I would thrust by doing a body drop over my contact, help the patient out. Over my contact, I would do a thrust from A to P, and with my weight over my contact across the patient's body. With a hip issue, so I'm going to assess for internal and external rotation. External, so pretty normal with that. The other one, external's good. Internal, there's a slight restriction. So what I'm going to be doing is a wax on. So I'm going to put my hand over so that it induces internal rotation. I'm going to have the patient place her hands underneath her buttocks to prevent from sliding. And then I'm going to lean back in my tug of war position and then give it a thrust, causing long axis distraction in my power position. Presents with a lower leg problem. When looking at the fibular head, I'm going to take it and move it in and out. And if it's not moving, which it is not, from P to A, I'm going to take my piezoform contact, place it on. I'm going to reinforce, support her ankle with my shoulder, and then I'm going to be pulling P to A on the fibular head to put it back from its restriction. Patient presents with a toe injury, the first great toe. So first I'm going to assess it by moving around, and if there's a restriction, I'm going to take my pincer contact, I'm going to grab the toe and mobilize it by moving lateral extraction, flexion, extension, and rotation.